Welcome to Chapter 10, video lecture number 2. In this video lecture, we are going to cover disorders of the heart valves, as well as disorders of the heart wall and congenital heart disease. So we are going to start off this video lecture with covering just the very basics of disorders of the heart valves. Now, there are two basic heart valve malfunctions that can occur. The first is called stenosis, and this is one of your terms. Stenosis occurs when a valve of the heart does not open fully, so blood cannot flow freely within the heart. This causes blood to oftentimes accumulate behind the valves, and anytime you have an accumulation of blood, you run the risk of having or developing blood clots. And obviously then if you have a blood clot and a part of it breaks off and goes to the brain, it can also lead to stroke. But stenosis is pretty well known to leading to chronic heart failure if it is not treated. One type of stenosis that we are going to talk about is called aortic valve stenosis. Obviously, this is where your aortic valve does not open up completely. This is very common in the elderly when their heart valves become calcified or hardened due to atherosclerosis. Atherosclerosis is one of your terms, and it means a disease of the arteries due to plaque buildup. Or you can say a hardening of the arteries due to plaque buildup. Now you might be saying to yourself, Miss Key, that sounds a lot like arteriosclerosis from chapter 9, and you are absolutely correct that it does sound a lot the same, and it is kind of the same thing. They both do involve arteries, but arteriosclerosis from chapter 9 is a general term describing the hardening of arteries. And atherosclerosis is a specific type of arteriosclerosis in which the arteries harden due to plaque buildup. Okay, so atherosclerosis is more specific than arteriosclerosis. Okay. Now, the second basic heart valve malfunction we are going to talk about is incompetence, which is also one of your words. And incompetence means that a heart valve is not closing fully. You might also see this as regurgitation, because when a heart valve does not close fully, it causes blood to regurgitate or flow backward through the valve back into the chamber it started in. So you might see regurgitation or you might see incompetence, but either way, that backflow of blood can eventually lead to chronic heart failure, just like stenosis. So remember, stenosis, the heart valves do not open fully, and regurgitation or incompetence, they don't close fully. Now let's move into disorders of the heart wall, and all four of these terms are on your word list. The word parts are going to help you to differentiate among them because a lot of the word parts are the same. It's just the beginning that is different. So the first disorder we are going to talk about is endocarditis. If we break this word down, the suffix itis means inflammation, the prefix endo means within, and the root card means heart. So endocarditis is inflammation of the lining of the heart. And in this picture, if you look up endocarditis, it's usually shown near the heart valves. This disorder is usually caused by an infection elsewhere in the body, and doesn't really just show up on its own. So if you have some sort of a bacterial infection elsewhere, it can make its way into the inner lining of your heart and cause that inflammation, and that's endocarditis. Some drug users who introduce drugs through needles or through their veins, and people with damaged heart valves are at a higher risk of developing endocarditis, but really, it's kind of the same risk for everyone if you don't do hard drugs or have damaged heart valves. The second disorder of the heart wall we're going to talk about is myocarditis, and it has the same suffix, itis, and the same root, card, but it has a new root in there that's myo. Myo stands for muscle. So myocarditis is inflammation of the heart muscle. This can be caused by infections like bacterial infections, viral infections, fungal infections, and kind of like endocarditis, it's usually a result from another disease in the body, like if you get like the flu, right? Influenza is a viral infection. It's not targeting your heart specifically, but it's kind of, it'll get there eventually. The third disorder of the heart wall is pericarditis. Again, you see that itis and you see the root card, but now we have a new prefix that is peri. Peri means around. So pericarditis is inflammation of the pericardium, or it's inflammation of the covering of the heart. So the very outside is called the pericardium. When that becomes inflamed, that's pericarditis. The inflammation of the pericardium interferes usually with the heart's ability to contract and expand normally, which obviously would then cause the patient's cardiac output to fall, which actually has a term, and that is cardiac tamponade. Tamponade is not one of your terms, but it means a pathologic or disease-caused compression of an organ. In the case of cardiac tamponade, it is compression of the heart. So when the pericardium is inflamed, it is compressing the heart, which makes it hard for the heart to beat. Finally, we are going to finish off this video lecture with covering congenital heart disease, which is abbreviated CHD and is on your list. Now, congenital means present at birth, so the following disorders are due to abnormal development of the heart of the fetus prior to birth or shortly after. The first one we're going to talk about is the atrial septal defect. This is a hole in the interatrial septum, so that kind of membrane between the two atria. So there's a hole in that membrane that allows blood to move from the high pressure left atrium into the low pressure right atrium. And then somewhat similar to atrial septal defect is ventricular septal defect, or VSD, which is a hole in the septum or the wall separating the two ventricles that allows blood to move from the high pressure left ventricle to the low pressure right ventricle. So you might hear people say they were born with a hole in their heart. They might be referring to ASD or VSD. The second congenital heart disease we are going to talk about is patent ductus arteriosus, or PDA. Now, the ductus arteriosus is a normal blood vessel in the fetus. You can kind of see it where that line in the picture is showing the defect. That blood vessel usually closes within 24 hours of birth. If after 24 hours after being born, that artery remains open, blood is going to move from the aorta into the pulmonary artery, which takes blood to the lungs. And if you know about the heart, you know that blood that is getting pumped through the aorta is being pumped at a really high pressure because it goes from the left ventricle through the aorta to the body. So it's a very high pressure push of blood. So if that high pressured blood is going from the aorta and leaking through the pulmonary artery, it is sending really high pressured blood through to the lungs. So that high pressured blood going to the lungs can actually damage the lungs. So this is something that you would want to get fixed should you be born with this? The last congenital heart disease we are going to talk about in this video is coarctation of the aorta. Now, coarctation of the aorta is a narrowing of the aorta shortly after the artery to the left arm branches from the aorta. So if you look at the picture on the slide, you can see where the coarctation is, which is a very narrowing, kind of like if someone pinched the aorta. So what happens, or what this causes to happen, is the blood that is getting pumped to the upper body, like the arms and the head, is going to be pumped at a really high pressure, because not a lot of blood can go down to the lower body because of that coarctation. So when the left ventricle pumps, that high pressure blood, a lot of it is going to go through the path of least resistance, which would go up through the aorta to the upper body. Some of that blood will go down through the coarctation to the lower body, but it's going to be a very low pressured pump of blood going down to the lower body. So it causes hypertension, which is high blood pressure, which is one of your terms, to the upper body, like the arms and the head, and it's going to cause hypotension, which is low blood pressure, which is also one of your terms, to the lower limbs, like your legs, due to that coarctation or the narrowing of your aorta. And that is going to be it for video lecture number 2.